I would just simply like to ask one question of Marie. How on earth are we going to keep our doctors in the north when they're paying abusive money like that in the south? How have we got any? You know, if our doctors thought for 1 minute that there was money like that to be made in the south, why are they here? You know, it must be a great pool for them.
I helped to organise this meeting, and I'm a member of a small Marxist organisation. And I've been at previous meetings that Mary's spoken at, and one of the things that came to my mind was, I think Marxists have something to say about this. And what I think they have to say about it is the concept of finance capital. Finance capital is out there in the world. It's the force of money on its own. It has to make a return, and anything that prevents that return being made has to be taken out of the way, it has to be smashed. And I think that's a useful idea, because what it says is that this is not, if you like, a standard policy. It's not as if, you know, if you spoke to New Labour properly, they would change their mind. Or if you got the most populist wing of Fianna Fáil, they would change the policy. That's not going to happen. Because what you find is that in Europe, there's a big drive to extend the same structures into Europe. And what happens in Europe is that there's resistance that slows down that process, but nothing that actually stops it or reverses it, you know, because the people who advocate it come back again. So that's one side of the thing. The other side of the thing is, I think it's helpful to cast our mind back to the period John was talking about. Because there was a period when the working class were totally victimised by the health service and totally dependent on charity. And that situation did not make the working class rise up. And the working class founded trade unions. And what happened is the trade unions proved incapable of dealing with that situation. And because they were incapable, just through the basic operation of labour power, of dealing with that, that's why there was a political party of the working class, the Labour Party, formed. And the Labour Party, in its youth, if you like, and also because of some of the needs of capital itself, to, you know, stabilise the population, stop really dying off and so on. Because of that, you did have a national health service. So one of the things that I would argue is, here we are, a relatively small group of people, seeing this juggernaut pouring down on us. And one of the things that we will eventually need, and I'm not saying it's going to spring into there, we will need a political party of the working class. And what we need to do with this issue is to formulate what the workers need. You write it down, say what they need, and then contact the people whose propaganda is away until we find our audience and be able to launch it.
How are you doing? I'm Harry Hutchinson, Mid Ulster Trade Union Council. I'm also a health worker, learning disability, County Antrim, North Abbey Hospital. So, but you know, I can see at first hand, front line, the cuts in services that's going on, and it's every day. It's quite abysmal. I mean, even in the last few months, I've seen under what we've called here Agenda for Change, that maybe John will be familiar with out in Britain. An awful lot of confusion of exactly what it means reading the document. Is actually, you would see very little wrong with it. But, you know, it's a bit like consciousness, you know, lags behind reality in these things, and the people that are working in these frontline services beginning to learn it firsthand, what it's doing to the level pay bands. Bank staff got overtime pay cut in February of this year, just brought in, announced straight away. Even today, when I've come from the hospital, there are some relief people that come in during the summer to help alleviate, you know, the pressure on the wards. We found out that they're not being brought in this summer. And this is all part and parcel to a trust that we have here that has to make 3% cuts over the next 3 years, totaling £120 million, which is already a service in absolutely dire straits at the present time. I mean, without taking up our friend's point behind here, I mean, there's a lot I think we can do, and there's a lot the trade unions can answer for. at the present time. But just to go back a wee bit, I mean, John, you give the figures there about the expenditure that we have now in the NHS, £105 billion. And from the both speeches that we're getting there, I mean, this, and as Patricia alluded to, it's privatisation. And I don't think it's necessarily a case that it's a matter of simply increasing expenditure that's going to solve this problem. I mean, the 800 million that John referred to, you can correct me if I'm wrong, that 800 million brought the NHS up about to the European average, or roughly the European average when that introduced, was that about 2 years ago under Blair. But it didn't significantly benefit services when it was introduced, that extra money. A lot of it went to GPs who were already doing the work over weekends unpaid and was given to those services. And it's not just a case of money coming in to sort it out. The second thing, and I think maybe hasn't been mentioned here, is the role of the drug companies. Because the drug companies, I mean, they're massive billion-pound, GlaxoSmithKline, one of the biggest drug companies that we have here. Very extortionate amount of, cost. I was recently over in Cuba, and they have a health service, despite being a third-rate world country, has got a health service that anybody would be proud of. And I remember going in to buy an antibiotic in a little place which I had to pay for, and effectively it was a few pence. And if you had bought the same services here, it would have cost God knows what, pounds. And it just shows you, I think, the difference between the private. In other words, we've gone so far down privatisation and the road of privatisation and centralisation. There are 17 hospitals. The Northern Ireland Assembly, that was previously set up here, are now centralising the NHS acute hospitals here, down from a total of about 17 at the time, down to about 9. And there's a centralisation programme. Now the point is that they have been unable to implement it at the present time because of the current crisis. But believe me, that is the set agenda that is now in place, there's now running. But I see it as a case that at the moment we're just defending services. There's no real hallmark on the way on how we can turn this process around at the present state in time, and that there's money going into these services, and the road that we're going down is further privatisation, further cuts, the process is going to be ongoing at the present time, and at the moment there's no end in sight onto the current scheme.
Question keeps coming up about the trade unions. The real problem we've got in Britain is the trade union link with the Labour Party. That is a huge, huge issue. From being the Labour Party as a vehicle for the unions to conduct their political agenda, it's become a lever for the Labour Party to actually pull the unions into line. And again that's working now. And basically the Unison in particular, the biggest of the healthcare unions, the affiliated political fund basically runs the union and calls all the shots. And we now have, in Unison in England, we have a head of health, or Unison in the UK, we have a head of health who has now been selected as a parliamentary candidate for the Labour Party and clearly is compromised on almost every aspect of her ability to negotiate with the government she wants to be a member of after the next general election. So, and the union hasn't had the self-respect to actually boot her to one side and say, well, let somebody else take over the reins and while this period runs on. So we have that problem. And interestingly, the union that's taken the hardest line and is actually taking a pasting for it in the media, the hardest line is one that's not affiliated to the Labour Party, which is the BMA, which has actually been attempting to resist some of the more wild and reckless of the Labour policies. And you've probably seen the news today, just assembled in 3 weeks a petition of 1 million signatures of patients resisting the centralisation of GP services into these mad new polyclinics, which is the idea of this mad new Labour minister, Lord Darcy, who's actually a top consultant, been wheeled in to actually try to give some credibility to government policy. He came out with this policy of polyclinics, which nobody had ever heard of before. Suddenly this becomes the thing that is now being rammed through up and down the country, and of course is now the focus for all kinds of renewed agitation. Lord Darcy is now busily reversing away from it, saying he didn't really mean what everybody's saying it means. Meanwhile, all the primary care trusts up and down England are busily drawing up plans to close GP surgeries and weld them together into big, vast units that nobody wants. So there is that side to it, but it is interesting that BMA has taken that stand and has shown that there is a huge amount of popular support for any kind of radical line which is resisting some of these policies. And this government, which is already, you know, about as popular as a dose of herpes, you know, is well on the way to actually ensuring that David Cameron gets an automatic re-election next time around. What do the unions conclude from this? We shouldn't rock the boat because David Cameron might take advantage. And so it's actually used as a reason for even less resistance to policies which are actually making the government more unpopular. But I just wanted to touch on two other brief items. The private sector has always wanted to carve a bigger element out of the public sector health budgets in Western Europe, the richer countries. They've always seen that. You know, the insurance funds which were collectively run in Germany and France, the public sector budgets in Scandinavia and the UK, they always wanted to carve more of that out and have the private sector play a bigger role. They didn't do it under Thatcher. They couldn't really significantly do it under Thatcher. There was a negligible amount of privatisation compared to what's happening now. So you have to ask yourself, why is it that New Labour in particular would actually be the government that's actually ramming through this privatisation at such a pace? And I don't think it's enough to just say, well, big business wants it. You know, the reality is this New Labour government has bought the politics of Thatcherism more than Thatcher did, and has bought it without Thatcher had the political sense to realise that a government that really antagonised people on the NHS would struggle to get re-elected. This is what Nye Bevan said in 1952. Any government that seriously detaches itself from the British people on the NHS will be doomed. Thatcher recognised that and drew a line. New Labour doesn't recognise that and is just pushing through these policies irrespective, with the backing, of course, of the trade union leaders. And that is a real big problem for us. And the second thing is, I think we have to be careful about this thing about the extra money in the NHS has achieved no benefit. Particularly for health workers and health unions, you have to be very careful of that one, because the argument from the right wing is that it's achieved nothing because a lot of it's gone to health workers. Well, it did, actually. Quite a lot of it did go to health workers. Firstly, they've employed a lot more than even after the rounds of redundancy we had in 2006, 2007. There's still a lot more health workers than there were in 1997, and they are delivering the results. That's why the waiting times have come down. It's why the improved performance is taking place, because more health workers are there. And we are in favour of having more health workers and paying them more money. So I don't think we ought to allow ourselves to be pushed into the, it's not achieving anything. What they're to some extent doing is making up for the fact that they were underpaid and under-resourced, understaffed in the previous government. And the second thing is, the drug budget. Yes, the drug budget's gone up absolutely massively. And that is private profit. That's just being ripped off out of the NHS far faster. The drug budget and the private sector supplies to the NHS have gone up in spending far faster than staff. And it's actually the private sector that's actually failing to deliver the productivity, not the NHS staff. And I think we need to be very firm on that one. And we need to say, look, you have achieved a lot with spending this more money, but we are wasting billions through PFI, through treatment centres we don't want, privatising this, privatising that. This is wasting huge sums of money we could be spending much better on patient care. Sat on billions of pounds of surpluses is not the way forward. We have to stop PFI in its tracks and have no more, and look at ways of getting out from under the contracts that have already been signed. We need to actually put the brakes on and immediately halt any further contracts to the private sector to treat patients and through treatment centres and so forth. And we have to actually use the NHS treatment centres, which are very successful, as an alternative to that. And if we start that way, we can start to claw our way back to the kind of principles, and we start to, instead of competition and rivalry between trusts and the bringing in of the private sector to create that competition, what we need to look at is back to the idea of some workers' control and some actual collaboration and working together with professionals, health workers, right across the board to improve standards and build services that really are responsive to patients. There's a huge pool of highly trained talent in the NHS, And it's just being desperately underused, alienated and driven out by these policies. We need to turn that around if we're going to rescue the NHS for another 60 years of delivering services that we can actually be proud of. We think it should be run for patients and not for profits. And it is possible, I think, still, given the tremendous support, whatever the union bureaucracy say, the reality is out there and on the streets, people actually support what we have to say and not what the union leaders and their friends in the Labour Party have to say. And we have to cling on to that desperately. And I've got the dash off, I'm afraid. So,
I just wanted to say that, you know, one word of hope now, I mean, for us is that at least people are beginning to see through the centralisation agenda, and they're beginning to realise that centralisation is actually an arm of privatisation, you know, and that's actually what it's all about. It's not about centres of excellence, it's about something else altogether, as Alice O'Connell said. And I thought a point that was made about the pharmaceutical industry. In the Republic, pharmaceuticals account for 44% of all our exports, and they've done this sweetheart deal with the Irish government. So we've got this crazy situation now where, in fact, generics are actually on sale for like 1 or 2p less than the brands. Hello, 1 or 2p less. And they've actually, we found out yesterday from somebody who actually knows that the industry succeeded in doing this deal with government, not alone like to keep prices, you know, absurdly high, because everybody knows I can go to Spain and buy the drugs for 1/3 what they're going to cost you in the south. But they've also done this deal where they're not allowing any value for money assessment of any of their products. So we can't have a nice, I mean, I'm not saying nice is, you know, the be all and the end all, but at least it's something, it's a mechanism for seeing, is your money going down the drain or is it going to something good, and controls on the money that they're making and on the prices that they're actually charging us. We have no controls. They won't allow us to have a formulary, which is, you know, the term they give to that list of approved drugs, I mean, which you have in an awful lot of countries now, and of course we have nothing. So. But that's how it is, and now, I mean, the fact is that we're looking at a recession. We don't know how long, how deep. We're looking at cuts which are induced by that recession, and kick-starting the cuts that were already planned years ago in terms of closing down all those hospitals. So, I mean, it's actually difficult for any of us to imagine the future, because it's. I mean, you know, I saw that John was quite optimistic there, but I have to say, you know, it's quite hard for us. I mean, there's no medical leadership. I mean, at least you mentioned there the British Medical Association, but I mean, which of the medical unions in Ireland has come out against any of this? I mean, we've got a Royal College in the south. I mean, the Royal College of Surgeons in Ireland, which is busy building health oases out like in Bahrain. You know, they've got a private hospital out there. And what they call a health oasis in Bahrain, and they are busy branding themselves all over the world. I kid you not. A turnover of 91 million in 2006, a charity, no taxes, no oversight, no scrutiny, no reports handed into the company's office every year, because we don't regulate charities. We've got a charities bill going through at the moment, but they're one of the biggest property owners in Stephen's Green, which is the heart of the city of Dublin in terms of prestige property. No taxes, nothing. Nada. I mean, it's almost hard to believe, really. And also, we've got in the south, I suppose, another factor has been that the opposition parties have been either incapable or unwilling, for the most part, to challenge what's been going on. They haven't been effective. We just haven't seen strong, effective voices. We've got complacent media, lazy media. Who seems to mistake, press releases for news and just like spins it out uncritically. So people really don't know. They're also being fed a lot of untruths. We're employing an awful lot of PR merchants, and we're going to get our polyclinics as well. We're busy corporatising GP practices. We've put 131, I think, sites out there to see. And a few weeks ago, I was at another conference where the man from the HSE stood up and said, "We went to the market and let the market come up with solutions. This is to the problems like in general practice and primary healthcare in the community. And one of the things that's happening now, I mean, and you see the push on from the private sector, it seems to me that patients are becoming collections of disease entities, really. And there's this whole push now just to treat the disease, right? So, you know, the ideal thing is to have a diabetes clinic in Sweden, which is also an obesity clinic, and, you know, so this is like the coolest thing. And what we're going to see more of is patient mobility. We're going to have this incoming health directive, apparently, which is being held back while we voted gaily on Lisbon today. And this is going to really knock us for six, because it means that people, they already have the right, but they don't know it, to travel for, if they've been waiting for an undue length of time. And there have been cases far more significant than the Watts case, in fact, at least two others, which were super significant, one involving a Greek national, the other involving a German national. And in fact, the principle laid down in that German case was that doctor decides, you know, so it's, in a way, it's back to medical power. And it's whatever the doctor decides is what the national insurance system has to pay for. She was actually a lady who got her form E111, which allowed her to travel back to Germany to see her family, because she was living in Spain. Then she discovered she had a cancerous tumour. She applied for the E112, which is for the serious stuff, not for the holiday stuff. She got that. And the doctors decided in Germany that the only place she could possibly get successful treatment was in a private clinic in Zurich, in Switzerland. The Spanish health, the insurance people in Salud refused to pay, and the ECJ eventually decided that they had to pay. It was tough cheese, even if they had nothing to do with the assessment, nothing to do with anything. It was a case of pay up. And the other case involving the Greek national also involved treatment in a private hospital in England. And in that case, apparently, Greece had a law which allowed minors up to 14 to be treated in private healthcare facilities abroad, but not over the age of 14. And the ECJ ruled that they couldn't do that, and that in fact that law had to be knocked off the statute books. So they couldn't make that distinction between the under 14s and the over 14s. So people are going to have the right to travel, and you know, is it going to increase? It will increase for the wealthy, won't it? And the well-informed, and the less well-off, and the less well-informed will be still sitting at the bottom of the heap. So that's it.